Hi, today we're going to give you a sneak peek into one of our Threads patients. We've been doing Threads for years now. Right when they were brought to the US market, we were really on top of it because we have a lot of colleagues and friends in Europe, and they've been using Threads for many more years than the Americans, so they gave us all their tips and tricks. The threads that are most common that you all see on Instagram is you see threads that are attached right here. We do those and those are easy, but we really tell clients that those last like a month, 2 months. Yeah. Our favorite though is scalp fixation, because imagine you're anchoring your bike to the cement. So we're gonna use her scalp, which has fascia, which is basically more of a cement type layer to fix her threads to.
Our goal today is to lift on the nasolabial fold and the side mouth jowling. Again, there are many different ways you can go about treating this. However, for Alexa, she already has enough volume in her mid-face. She does not need more volume. So that's where threads are going to come into play for her. They're going to be able to give her a lift without volumizing her. She currently has fat in all the right places. She just wants to prevent her fat pads from falling down and forward and falling on top of her current fold. That's where the thread comes into her aging plan.
Yeah, so she basically wants to look like she's always wearing a tight ponytail without the tight ponytail.
Exactly.
You ready, Alexa?
I am.
Okay. Yay. We do two kinds of threads. We do one that's called scalp fixation and one that is non-scalp fixation.
If you're looking for a longer lasting result, you need to do a stronger fixation. A fixation that's going to have more tape to hold everything in.
For Alexa, she wants to have as long-lasting results as possible.
And that's really where, if you have an advanced technique, you're able to go from a scalpel fixation. That's where you can get a longer lasting result because they're not going to fall forward. Alexa's a great candidate because she's got really strong fascia because of her age and her genetics. Fascia being the sphinx of the face. You already have really good fat pads and you already have good bone, but you want more lift. Your muscles don't allow you to put more filler in your face to restore and replenish. Then threads is a good option for you. So if I were to place a thread in her, the thread is going to have much more of an ability to stay where I put it and hold tight to the rest of her face. Just like you can graduate to threads in general, you can graduate between threads. So there are beginner threads and there's more advanced threads.
There are definitely people watching who have had threads and they're saying, I had threads and they didn't last.
If somebody's much older and they're trying to get threads and they haven't done any tightening lasers, their fascia is a little loose and their fat pads have dropped, their bone hasn't been replenished, they most likely will not be a good threads candidate.
The point is, come to GoodSkin because we're going to expertly diagnose you. So if someone's not a good candidate for threads, we might use Accutite, we might use Morpheus with tumescent.
Just because you might come in and get diagnosed doesn't mean you're not a good threads candidate forever.
Sometimes we actually will use volume like Sculptra and get someone's tissue to be thicker so that then they can use threads. So some of the things we've seen with threads when your thread isn't placed correctly is that you will see too much bunching along the thread line. It's normal to have bunching in the back.
Yes.
It's normal to have some bunching up here, but we don't want to actually see the thread under the skin.
You don't want it to look like you pulled a string on a shirt and it ripples. You do not want that.
Now, threads can be controversial. I myself have seen some plastic surgeons say they don't like threads, and then basically a couple months later start using threads. Some of you are probably thinking, she's too young for threads, she shouldn't have threads. And there's others that are thinking, yay, go Alexa with threads. So I think that the thing to do as a patient is to be at a clinic where they're experts in threads. They can tell you what will go wrong, what possibly can happen in case, a thread were to break, how they would resolve that. So basically choose a clinic that has been doing threads for a long time and even understands the differences between threads. And what we have found is that threads can be very preventative for aging because they did a study last year. It was a revolutionary study because it proved that around every thread you do form a little bit of collagen. The point is, come to GoodSkin because we're going to expertly diagnose you, and that's one of the many details ways that makes us
unique in threads and expert in them as well.
Yeah.